As we age, as we become more mature, actually these vessels become rigid. Why they become rigid? Because they lose their elasticity. But the problem is, as we age, these vessels become rigid and now we have less volume. So when there is more need of blood, they exert pressure on the walls of the vessels. The question is how we can prevent being hypertensive. Our sympathetic system is oversensitized, is being overused. That can lead to hypertension. So one way to prevent that is to control that sympathetic system. We are surrounded by stimulating news, stimulating things. Our relations are strained and they cause more stress on us, and similarly our food causes stress. So we are being stimulated from all corners. As a result, by the time we reach mature age, we become hypertensive. So one way is to control those areas, especially your relations, and especially if you have any fear. So you have to work on those. You cannot just say, look, I am like this, I have these fears, my strain, my disposition is like this, that I get angry, frustrated, and I'm an irritable person, so bear with me. No, you have to control. You have to become emotionally intelligent person if you want to control your blood pressure. Another action that help you reduce your blood pressure is physical activity. When we increase our physical activity, our muscles are contracted. What happens is the collaterals open. Now these collaterals, if they are not open for 40-50 years, they will not open if we start too late our exercise. But for exercise, it's never too late. Collaterals still can be opened. But the only thing you have to do is you have to be very gradual. Aerobic activity, which means that our bigger muscles, they contract in a cyclical fashion. So jogging, walking, fast walking, swimming, stationary bike or bike, all these things are means to do aerobic activity. If you are starting an aerobic activity, make sure that there is consistency, and that consistency can be achieved only if you go very gradual. Otherwise, one of the joint or tendon will be strained or sprained, and you will stop the aerobic activity, and then after a few months you have to start it again. So aerobic activity will help not only open the collaterals. So when the collaterals, which are the vessel's side channels, are opened, what happens? The total volume increases, and as a result, that stretchability loss, that elasticity loss is compensated by the new channels opening, increasing the volume and reducing the pressure on the walls. If we can fix those things, the blood pressure, you can manage it very well, and you can prevent having high blood pressure, because all the medications that are given for high blood pressure have so many side effects that now your blood pressure is maintained, but now you have to deal with those side effects.